Good morning, everyone. Dan Bates, President and CEO, Greater Hamilton Chamber of Commerce, and we're glad you could join us today for Coffee and Conversation. We're going to be hearing from William Jewell in just a little bit from American Senior Benefits, and this is a topic that I get questions about all the time. So, understanding Medicare because it's not that simple. So we're glad that we have a presenter on this today. So we are on Zoom, so I'm sure William will not mind if you interrupt him with questions. If you're on Facebook Live, type your questions in and Laura will get them answered for you. And so you know who I am, you know what the protocol is, and you know who our presenter is going to be. So with that, we're turning it over to Jason to do self-introductions.
Thanks, Dan. Hey, everyone, I'm Jason with the Greater Hamilton Chamber. Laura, can you introduce yourself?
Hello, everyone. I'm Laura Merrill with the Greater Hamilton Chamber.
Thank you. Sandy, can you introduce yourself?
Sure. Good morning. Sandy Kusnoff with Brains Glass.
Thank you. And Bill, whenever you're ready, you can take it away. And feel free, if you'd like to pause between each slide to ask questions, make it as interactive as you'd like, okay?
Yeah, absolutely. And same thing. If anybody has questions, just ask. We can stop and try to answer those the best of our ability. And one thing I do want to kick off is like there's some things that like this is geared towards the average person because when it comes to Medicare, it's so individualistic that like what we're going to say is like the average experience for people and people that have like the average income and those sort of things because income levels will affect different aspects of Medicare. And so, everything that I say today may not ring true for everybody. That's why we always recommend sitting down with a local agent that you can sit down, you can see them, meet with them in person, and kind of go over your individual situation because they are totally different. So, with that being said, let me share my screen here. Can everybody see that?
Yep.
Okay, so most people get this Medicare and You book when they're getting ready to turn, usually about 3 months out. They don't send it to everybody. We don't know why. Some people get like a shortened book, but this is like every year they put out like a nice little thick handbook of Medicare and You and all the changes in there and just the way that it works. And we use a lot of that in this presentation. So I'll be sharing some of those pages with you and just be looking for that. If you don't have it, you can go to Social Security. They run out of them quickly, but you can go to your local office and request them and try to get them there. Just a little bit about me. My name's William Jewell, Bill Jewell. I'm with American Senior Benefits. I'm a licensed agent. I'm licensed in Ohio, Kentucky, Indiana, and Florida. I've been in the insurance industry for about 5 years. Prior to that, I was an educator for about 20 years. Everything from a teacher, principal to I was a head high school football coach. As a matter of fact, around 2010, I was the top three candidates for Hamilton High School's football team there. So we had just come off an undefeated season where I was at, and so they were interested, and so I got to interview with them. I didn't make it, but I was in the top three, so that was kind of cool. I usually have like there's some major discussion objectives that I want to kind of go over today with everybody. One is understanding how original Medicare works just by itself. Because there is just original Medicare that's offered by the government that you don't have to add anything to. It's like the base plan. It's what you paid into, and there's like just this is how it works, and there are gaps in it, so most people don't stick with that, but I think it's important to know how that works on its own so that you know why you're looking at some of the other choices. Then we're going to look at how original Medicare works with a supplement or a gap plan, also known as Medigap. So you can have original Medicare, and then you can get a plan because original Medicare does have gaps where you're going to have to pay for services, and so to cover those gaps, one way that they take care of covering those gaps is they get a Medigap plan or supplement. Those are synonyms, okay? And then another way that they cover those gaps is they get a Medicare Advantage plan, also known as Part C. And I want you to understand how that works as well today. So, and then also what is not covered by Medicare, because some people, they get to to that stage where they need something, they think it's covered by Medicare, nobody's ever told them it's not, and then they're just, kind of stuck and trying to scramble some things together, resources to maybe take care of some issues that they didn't realize was not covered by Medicare. Any questions so far? Okay, so I know this is a little grainy, but this is from that Medicare New book. What are my Medicare coverage choices? Okay, and straight from that book, there are two main ways to get your Medicare coverage: original Medicare or Medicare Advantage plan. And then you use these steps to decide which way to get your coverage. And we're going to go through this right here. So this is the chart. They don't have this in the newer books. I still use this chart. To me, it's a really good representation of what your choices are and a good visual representation of that. So your very first step is decide how you want to get your coverage. Or do you want to go with original Medicare, or do you want to go with Medicare Advantage plans? Okay, and then there's parts to those. And what we're going to do is break down each of those steps. Okay. Now, how agents are compensated. I think this is important to understand how agents are compensated, so that it's just a question a lot of people ask. There's confusion behind that because some of the plans, if you get them, you're not paying any extra premium. They're like, well, what's in it for the agent? Okay, and so if you look at original Medicare and Medicare Advantage side, on original Medicare, there is no compensation for the agent if you just sign up for original Medicare. Now, most people don't do that. I would say 99% of the people I've sat with never do just original Medicare because of the gaps that I will go over here in a few minutes. But they add a supplement insurance policy to that to cover those gaps, also known as Medigap. Okay, and when that's the part that the agent gets compensated on. So this Medicare supplement insurance plan is that goes along with original Medicare. That's how they get compensated. The other way they get compensated is if they choose Part C, Medicare Advantage plan. That's choosing a private insurance company, right? And so with that, there's a different compensation for that, and each company has a little bit different scale. I will say, in my experience where I've been, and this may not be true for every agent, but the Advantage plans pay roughly double in compensation than the supplement plan. And I only say that just to make sure, if you're working with someone and you feel like they're steering you to one way and they don't even want to talk about the other way, that could be an issue. It's that, like, you don't want to work with someone where their compensation is going to determine what your choices are, right? Also, I think it's important, and there's a lot of great agents out there, but some agents only do original Medicare supplements. Some agents only do Advantage plans. And then some agents only work for one particular company. And I think, obviously, the more choices and access you have to compare what's best for you, I think you find yourself in a better situation. So that would be some advice for me. If I was looking for an agent, I would want one that does both sides of Medicare, and they're appointed with several companies so that we can make comparisons and see what's best for us. Any questions on that part? Okay.
I don't have any questions.
Okay. Thanks. Okay. Let's see.
And Bill, did you say that we would have a copy of this chart at the end?
I could provide that. Yeah. This used to come in the old Medicare New books, but they don't use this chart anymore. But to me, this is one of the better charts.
Yeah.
I really like this chart. Now, right now, what we're going to do is I'm going to break down just how original Medicare works, what those gaps are, and what that looks like if you just had original Medicare and you needed to use it. Original Medicare consists of parts A, B, and D, which is the drug. D is the drug coverage. Okay. Part A is the hospital insurance. That's for bed and food when you go to the hospital. Part B is the medical care. What pays the doctors, the surgeons, the surgeries, the x-rays, like all the actual Medicare happening. Okay. So Part A of Medicare. So that's the hospital insurance. Now, to qualify for a no cost Part A, you had to work 40 quarters or at least 10 years paid into Social Security, and then you get that for no cost. If you were a stay at home spouse, um, you can claim and use your spouse's hours. Those can count for you, but there are there's some circumstances where that you need to be aware of if that would be a situation that you would be in. So it's definitely worth talking to someone about that. Now, if you have less than 40 hours but more than 30 hours, you're going to pay a premium of $285 a month for Part A. And then if you have less than 30 quarters, you're going to pay $515 a month for Part A. Generally, when I see this, it's someone that maybe came over to America later in life, became a citizen, and then started pay. They only worked 5 years here and was able to pay into it. That's where I would see that happen most of the time. A situation like that, and it covers hospitals, skilled nursing facilities, some home health care, and then hospice care. That Part A pays for hospice care. And then, so what happens is the government contributes, and you'll see this when we get to Advantage Plan too. They contribute a portion. You don't see this anywhere. This is not recorded anywhere, but just know that money is coming from the government to on your behalf, either to the original Medicare program or it goes to the private insurance company if you choose to go Part C, and we'll talk about that in a minute. But Part A costs $0 to have. It covers bed and food in the hospital. And think of it as benefit periods. So if you go to the hospital, it starts a 60-day benefit period. And anything in that hospital, as far as bed and food only, it's not the medical care, you're going to pay $17.36 for that whole 60-day benefit period. Okay. Now, if you're in there 2 days or if you're in there the whole 60 days, it's $17.36. That cost does go up every year. Just so know if you're planning and you're 10 years out, that's probably going to look like 2000 something because that goes up every single year. Okay, so if you are in there for starting day 61, if you're consecutive, and this happened during COVID, right? We all know people that were in the hospital this long during COVID. You starting on day 61, you pay $434 per day. Medicare covers all the other costs, but you pay $434 per day. So you would have paid the $17.36 for your first 60 days, then $434 per day through day 90. And if you're in there longer than that, starting on day 91, your daily rate goes to $868 per day. That's what you would pay. That would be your portion, and Medicare would pay the rest. And then anything over 151 days, Medicare stops paying. That's all on you. I know I went in the hospital one day for AFib, and it was it was like $20,000 for one day. So, and they didn't do much medical on me. They just ran like EKG and stuff. So most of that cost was just the staying in the hospital. Skilled nursing, days 1 through 20 is covered. So you can go to rehab, skilled nursing, days 1 through 20. Medicare pays that all. Starting on day 21 through 100, there's a $217 per day that is your cost. And then after 100 or more days, you pay all. Now, these are the gaps that they talk about. This is part of the gaps that you would have to pay, and if you were just on original Medicare. Any questions about this?
No, you're doing good.
Okay, so Part B insurance. Now, there is an income stipulation on Part B insurance, but for incomes between 106 individual or 212 a couple, that anybody that makes that or under, right now, this year's cost was $202.90 per month. Okay. And so that's a cost that a lot of people don't think about. Like you need to, and especially if you're 10, 15 years out from Medicare, like that 202.90 goes up every year. When I started just 5 years ago, that was like 160. So it's kind of went up quite a bit. So who knows where that will be in 10, 15 years. So you've got to be prepared in your retirement that, it's going to be, if you're a couple, you're going to be paying probably, $600-700 a month just for the Part B premium. Okay, to have that. If you're on your own, you're probably going to be paying closer to $300, depending on how far. And so you got to start working that in your budget and be thinking about that for your future. And it is a progressive. The more money you make, you do pay a higher premium, and it does cap out right now at 628 per person. Then after that you could, it's unlimited. It like caps there. So what Part B covers is the doctor visits, outpatient hospital services. It covers clinical lab tests, durable medical equipment, ramps, things to help you get in the shower. That's durable medical equipment. Things for diabetes to help with different diseases, oxygen tanks. That's all durable medical equipment. Preventative services and prescriptions while at a facility. And I always say this is important. This is a big caveat. Prescriptions at a facility. I have an aunt that she's on Medicare, original Medicare with the supplement. She has to take a shot once a month. It's like $500 a month, but she takes it at her doctor's office. And since it's at a facility, it's covered under Part B of Medicare.
Bill, I have a question.
Yeah.
So for the income level, if you're, if somebody's working and they sign up for, Medicare while they're working, and then their income decreases dramatically once they retire, is that adjusted, or is it based upon whatever they were making when they signed up?
They'll go back 2 years, but it is adjusted. And there, you can write appeals for certain situations. Like I had a client that had a huge severance package, and so that was going to put him at the very top level. But they could see that in the letter that like this was a one-time thing. That wasn't what his pay always was. It was just his severance package. And then they actually, when he appealed it, they put him down to the level that this level here. So
it can be adjusted based upon reduction of income.
Right. Yes. Good question. Now, the Part B monthly premium right now, like I said, is $202.90. And if you're on Social Security, they take that right out off the top. If you're not on it, then they bill you for that. Okay. It has a yearly deductible of $283. So what that means is you pay the first $283 of your care, and then the Part B kicks in, and it covers 80% of outpatient medical services, preventative care, diagnostic tests, MRIs, X-rays, durable medical equipment, all the things that we talked about. Your surgeries, everything's covered here. 80% on the government. The government's actually paying that part, Medicare, and 20% on you. Okay, which is another gap. And then this 15% excess charge, if you live in Ohio, that doesn't, our state legislature doesn't let them charge that, which is a good thing. But like I know Florida and Indiana, they do have that excess. In Kentucky, they have that excess charge as well, but they don't have that in Ohio. So the one thing to remember about the 20% is that can be an unlimited number, right? It's 20%. If you have $1 million in medical bills, you're responsible for 20% of that if you stay on original Medicare. And those gaps are why most people don't stay on original Medicare. Like they get something, either Part C or they get a gap plan to protect themselves. Now, along with original Medicare, in 2003, they introduced the prescription drug plans. It's for all people with Medicare, provided through prescription drug plans, Medicare Advantage plans, and then there's some other just different types of Medicare plans also. You can get through the VA as well if you're eligible for that. And you have to have a prescription drug plan, even if you're not on prescriptions. The government requires you to get one. A lot of people think, well, I'm not on prescriptions, I don't need to sign up for that. Yes, you do, or you'll be penalized, and that penalty can, it can be pretty detrimental because once they penalize you, it never goes away. And so you want to make sure you get one, but there are some zero premium plans, which a lot of times that's what we'll do with someone that doesn't take prescriptions and put them on a zero premium plan. With the caveat, and the one thing that you can't predict about prescription drug plans is you can only do based on the prescriptions they're on today. Like in in 3 months, if the doctor puts them on a prescription, that may not be the best plan for them. But that's why every year they give you a chance to evaluate your plans, look at them, and change them. But you might be stuck in it for, in that case, you'd be stuck in it for 9 months, until you get to make some changes. Now, so we talked about original Medicare, right? That part. So what we're going to do now is focus on the Medicare supplement insurance, the gap plan right here, how this pairs with original Medicare. So the gaps that we talked about are right here. This is like the Medicare, and this may be hard to read. Let me know if, you may not be able to see this, but just to show you that, like, these are the gaps that Medicare doesn't cover. But now the most comprehensive plan that they have out there is called the Medigap plans, the G plan. It covers 100% of all those gaps except for the Part B deductible. Now, if you look next to it, the F plan used to pay 100% of the Part B deductible, but the government stopped allowing those. You had to turn 65 before 2020 to get that. So now the most comprehensive plan is the G plan. Okay, so it covers 100% of all the gaps except for Part B deductible. So what means is if you get a G plan, you pay your with original Medicare paired up. The only medical costs you have is the 283. Once you pay your 283, you have no more medical costs. Now, that does not include prescription drug costs. That's outside of the medical costs here. So that's the most comprehensive plan on the today. The interesting part is these G plans are given by different private insurance companies, but it doesn't act like private insurance because it has to pay the gaps over here that original Medicare doesn't pay, right? So they don't have a choice to choose to pay it or not to pay it. If they have a supplement plan, it's got to pay the gaps that your Medicare plan didn't pay. And there's no questions asked. So you're getting it through private insurance companies, but it's not really working like private insurance company, if that makes sense. The other plan that's kind of similar to the G plan is the N plan, and it's the only difference you see these asterisks next to Part B coinsurance is you pay $20 to go to the doctor, and you pay $50 to go to the hospital if you don't get admitted. And so that's an added. So the 283 plus that is what you would pay on that plan, and they're usually a little bit cheaper than the G plan. So some people look at that, and it doesn't pay the excess Part B charge, but in Ohio we don't have to worry about that. So that's what makes it really comparable to the G plan for a little less cost. Now, again, these are provided through private insurance companies, but it's got to do what the government says it's got to do. And a G plan can, depend on what company you go with, they can range. There can be hundreds of dollars of differences in price, but it's still providing the exact same thing that it says it has to provide. Any questions on that part? Because I know that can get a little confusing.
I have a question.
Yeah.
They're just focusing on prescriptions. Is there a difference between 1, 2, and 3 tiered drugs as far as payment and that type of thing?
Yeah, definitely. Yeah, there are. But that's kind of outside of the supplements because the supplements don't pay for that. That's a totally different. Even though it's part of original Medicare, it's outside of A, B, and a supplement. So A, B, and a supplement go together. And Part D, even though it's a part of original Medicare, it kind of works on its own. So, and depends on which company you go with, and the formulary is what could be the difference in prices on the drug costs. And that's why we always recommend every year having someone come out because they, like 2 years ago there were 23 drug plans. This year there was only 8 or not. Was there 8 or 9? So that's a big difference. So there's a lot of changes in the drug plan market, and if you don't run those every year, because they're renegotiating those formularies every year and they're reworking those. And you got the pharmacy involved, you got the manufacturer involved, and you got the insurance company involved. So that's a lot of negotiation. A lot of changes happen, and we recommend having, if you are on original Medicare with a supplement and on a prescription drug plan, you should have somebody come out every single year between October and December and run your drug plans and make sure that you're on the best drug plan, or there's not a better drug plan for you. If you're not doing that, you could be spending a lot more money than you need to be. Okay, so now we've covered this side of the board, right? Original Medicare, how it works, then the supplement, how that covers those gaps. Okay, and now the you're going to be looking somewhere between for an in plan. They range, and males are always more expensive than females, but they're going to range from 80 some bucks to $200 for an M plan, depending on which company you go with. And then the G plan is going to range from probably around 100 bucks to up to 300 bucks, depending on which company you go with. So there are some differences in price there. And any questions on that?
So I have another question, Bill. Sorry.
No,
So
that's good.
when you add up these costs, okay, you're talking about prices that are getting up to the level of just regular insurance. It's not really a savings.
Yeah. Now the one difference, I agree with you. Like a lot of if you look at your group insurance versus your original Medicare with a Medicare supplement plan, the only difference is you have a $283 deductible, and you have and this is why people choose that side, because when you look at the cost up front monthly, it's going to be more, right? You're going to pay the Part B deductible, you're going to pay the extra, you're going to pay your drug premium, and then you're also going to pay for the supplement, and you're looking at probably $300 to $500, and that price is going to go up every year, and that's per person. The difference is most group insurances that you pay that when you're working, you still got to pay that 20%. You still have costs. Here, after the 283, you have no medical costs. So that's one reason why people like to go that side. Another reason why people like to go this side of the board is there are no networks. So you can go to any doctor, any hospital, anywhere in the United States. So you're not bound to your network, your HMO, and your PPO. So there are some significant differences. It is the most comprehensive insurance you can have, because if your doctor says it's medically necessary, they do it. No questions asked. You're not like, you don't have anybody in between that. So some people, that cost of that is worth the peace of mind of having that kind of level of insurance. And I do know there's there's people that will come out that can do things to help people, with their medical issues, that only if they're on original Medicare with the supplement. Like they don't get that same service if they're on an Advantage plan. But there's some advantages to Advantage plans, and we're going to talk about that. So Advantage plans, what it does, it's Part C, and it works like an HMO and a PPO. So it's something that people are used to, because if you had group insurance for work, that's kind of what you had, right? And what it does is it combines parts A, B, and usually D. So it puts those all in one plan and there's no premium. You don't pay any extra a month to have that. Okay. Now, the difference is you don't pay anything extra to have it, but you will pay as you go. So you're going to pay co-insurance and you're going to have co-pays, but they're going to protect you with something called the max out of pocket, or the MOOP. Okay, the MOOP protects you. That means once you reach your MOOP, your max out of pocket, you have no more medical bills. And so that's what really protects you from that unlimited liability. Like if you just have original Medicare, you have unlimited liability with that 20%, right? You either protect that unlimited liability with a Medigap plan, or you protect it with a Part C plan, because it's going to have a max out of pocket that prevents you from having $200,000 in medical bills.
Does that include prescriptions, max out of pocket?
It does not. Good question. It does not include prescription costs. So, Part C was enacted in the Balanced Budget Act of 1997. Private insurance company received funds from CMS to bundle A and B, in most cases D, benefits, and it began in 1999. Real quick, most cases D. There are some MA only plans without prescription drug plans, and the most people that use those are people that use the VA for the prescription coverage. So they get their prescriptions through the VA, so they don't really need that. And some of those plans can have some extra benefits because they're not providing that drug plan. CMS oversees these private insurance companies and they assign a star rating from 1 to 5. So if you look and they have star ratings, that's CMS is giving them that rating. And the higher the rating, the more funds that they get to manage their plans. And private insurance companies set up the HMOs and PPOs, kind of like group insurance, right? And then they negotiate fees and increase the network. Now that happens every single year. On the Vantage plans, every year, that's why that's a big rollout. We find out, late August into September, like what are the new plans going to be? And that's all the buzz because that's the Advantage plan side. That's the private insurance side. And they're all vying for the dollars because they get a stipend from the government. If they take you on, the government gives them an extra stipend. Fees are generally negotiated yearly, and providers can't opt in and out. That's one issue that people don't like is a provider can give 30-day written notice that we are no longer going to accept this insurance. And if that's your insurance, you're stuck with that, depending on what time of year it is, you could be stuck with that for months and have to find a new doctor. This is a thing, too, where you hear every once in a while, like, a hospital network they are not accepting this plan this year, and everybody's scrambling to get a new plan because that hospital's out of network. So that just means their negotiations broke down and they weren't able to come to terms on the cost and how they were going to provide that care. Now, the one thing to remember is you still pay, even though the Vantage plan has no extra monthly premium, you do still pay the $202.90 because a lot of people will say like, hey, you can have this free plan. It's like, well, it's not really free. You're still paying the $202.90 no matter which side of Medicare you go on. So that's going to be your base fixed cost. Now, depending on income level, you can get something called extra help if your income is under certain amounts in your living situation, how many dependents and all that. That can change the amount of your Part B premium. So that can be reduced also through extra help and through Medicaid and county services. But the care has to be approved by the insurance company. So one thing that people don't like about Advantage plans is you have to get insurance companies' approval to do certain things. And sometimes they do deny certain things to be done. And the networking coverage is determined by the plan you choose to go with. But remembering that it's also in your zip code. I always tell somebody, if your aunt down in Georgia loves a certain company, that doesn't mean that might be the best company in the network where she lives and her prescription drugs that she's on and her doctors, but that may not be the best plan for you. So like these are very individualistic. I have a lot of couples who one couple is on a one plan and the other is on a different plan because their individual needs, like what their prescription drugs are, and if they have different doctors, is really going to be a driving force of what plan is going to be better for them and have the lower costs. I feel like some people just want like, oh, we have to have the same. We have to be in the same plan. And it's because they're thinking like group insurance, but this really is individualized healthcare, and it may be a detriment to be in the same plan. Now, we tell people that, but they still sometimes they just feel comfortable being in the same plan. So, obviously we do what they want. Now, so kind of to break this all down, you have in supplement, no copays, no co-insurance, a $283 yearly deductible. You can go to any hospital, any doctor, anywhere in the United States. I will say, like, I had a client that his plan, he had cancer, and his plan would not let him go to the James Center, and he kind of, they felt like that was maybe a place that they could have went to get some help, but they wouldn't take his plan. So that can happen. Like the Cleveland Clinic won't take Advantage plans out of network. So that's something to keep in mind. Like if you want access to the Mayo Clinic, Cleveland Clinic, that's going to be done on the supplement side, where you can go to any doctor anywhere in the United States. Okay. On the Advantage plan, they bundle A, B, and D, and that equals C, right? There's zero extra premium. That's people love that part. But you do pay copays, coinsurance, and deductibles as you go, and they're going to be provided in an HMO or PPO, which means you will have a network, so it will limit some of your choices. But you are protected by the MOOP, the max out of pocket, and another reason people like these is they do have some dental, vision, and hearing, and people feel like they want that. Okay. Any questions about that so far?
No, I don't see any questions.
Okay. So now there are certain situations that everything we talked about doesn't pertain. You just throw it out the window because it doesn't pertain. If you are dual eligible, they're called D-SNPs, dual eligible special need plans, and that's for anybody that has both Medicare and Medicaid. Everything that we talked about, if you're on Medicare and Medicaid, throw out the window. It's a unique situation to you. Definitely sit down with someone. That's a lot of times this is where the bigger benefits come in for people that get confused by the commercials, because people see the commercials and like, I want that, and a lot of times those commercials are really targeting the D-SNP, where they're providing like extra grocery money and those sorts of things. But if you're not on Medicaid, you're not going to qualify for that. So, and then you have C-SNPs that are chronic condition special needs plans for individuals with severe chronic conditions. There's some plans out there that can help them in that situation. And then I-SNPs for if someone's in a nursing home or a facility. If you fall in these categories, so you can throw everything we said out the window. It's a totally different situation. And then when can you enroll in Medicare Advantage plans? So you have 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65. Or that's one way, or when parts A, B become effective. Now, when can they become effective? If you have credible work coverage until you're 72, that becomes your initial enrollment period. Okay. Some people, if you're on Medicare disability, and you've been collecting if you've been collecting Social Security disability for 2 years, you qualify for Medicare, and then that would become your initial enrollment period. So, and that can be at a younger age. So you could be 55 if you're on full disability and you're getting your Social Security income disability check. Then after 2 years, you qualify for Medicare. And then annual enrollment period, that's from October 15th to December 7th. That's where all the commercials start really flooding in the TVs. That's when you have the chance to make your change for the new year. Okay, that's your annual enrollment period. And then special enrollment periods can be year round. Like right now, there's a special enrollment period because of the snowstorm that we had, and that lasts till June 1st. Like I know in Florida there's hurricanes that will cause them. So there's things that happen that can cause a special enrollment period throughout the year. And then open enrollment period. A lot of people get this confused with annual enrollment period, but it isn't, and it's important to understand the difference. Annual enrollment period is you're making all your changes for the next year, right? Starting January 1st. Well, from January 1st to March 31st, you can change the change you just made. If you decide you don't like it, you can make one change in the open enrollment period that ends March 31st. Okay, so that's why people start getting bombarded with calls, because you're going to be called by agents through annual enrollment period and open enrollment period. Then the calls slow down a little bit for everybody, but then that's why every year about that time you start getting a ton of phone calls.
So,
Any
Bill,
questions?
I have another question.
Yeah.
You said something about because as you know, people are working older and older or going
Yeah.
to work and that type of thing. What was it that you said about 72?
Well, I just throwing out a date. Like if somebody worked and they retired at 72, and they were on their work insurance, that becomes an open enrollment period for their initial enrollment period. Um, and the initial enrollment period is the only time up. Well, sorry, let me go back to that. That's the only time you can get that Medicare supplement without medical questions. So that's an important thing to know. And I'm going to go back up to so just go back up to the chart here. So this part right here that covers the gaps, the Medigap plan, the only time you can get that with no underwriting is when you're turning 65 or when you're eligible in that initial enrollment period. After that, they're going to ask you questions, and I've had several that I've tried sent through underwriting that got denied, and they can't. There's some reasons why they want to go back to original Medicare with the supplement, and they can't. So that's important to keep in mind. Like when you're turning 65 is the only time you get this part without medical underwriting. Now, some states are making changes, like Kentucky, and I think Indiana has it now. It's called the birthday rule, where every year during your birthday, I think they're opening that up with no underwriting. I don't know if Ohio will follow suit. Um, and do that as well. I guess we'll find out in time. But right now, Ohio does not have that. You have to go through a full underwriting to get back on a supplement. And then let's see. So now, what does Medicare not cover? So it's important to understand what Medicare does not cover. It does not cover long-term care. So long-term care is, you went to the hospital, they might have sent you to rehab and you're not getting better, but you still need, assistance and 24-hour help or whatever. That is not covered by Medicare. So there's only three ways to get it: cash pay, at a facility, which I think they average between like 4,000 and up a month. Spend down all your assets until you have $2,000 worth of assets. That does not include your primary residency and your primary vehicle, but you can't have more than $2,000 in assets, and then you can get it through Medicaid, or there is insurance for that, which can be a lot of different companies do it. So some people take care of that way. Okay, routine dental, eyeglasses, and hearing. Advantage plans pay for them. Original Medicare does it. You can be if you're on original Medicare with a supplement. A lot of people are cash payers. Some people add additional coverage. It just depends on the person. And prescription drugs, you get that through a Part D plan, Advantage plan, or VA benefits, usually. So just know that Medicare does not cover all these things. Okay. And then four areas we always say you need to be thinking about that kind of work together is, the medical costs we just talked about, right? This is all Medicare, but final expense planning. Social Security only gives you $255 per family for funeral costs now. We always say like back when, and that's the same price it was when Social Security started. So we say back then you could buy a truck. Today it's not even a truck payment, so that price hasn't went up, so it really doesn't go real far. Long-term care, again, not covered by Medicare. And then your financial security, your retirement. How do you want to protect this from these, right? So how do you maintain your assets with the medical expenses, long-term care, and how can you put together a plan to protect that for your family? And then why final expense planning? Some people do that for spousal support, gifting, or there's some tax reasons why they do final expense planning. Long-term care, just keep in mind, it's a spectrum. Oh, there's a spectrum of care on long-term care. And you can, maybe it's some home health care, maybe you need a little assistance at home, assisted living, nursing home, or long-term care. Most people will be at some part of this spectrum. Well, the government says 70% of all people will need some type of care. whether it's at-home care or long-term care. 70% of us need it, and a majority of us just have our family members help us do that, or the family member takes care of that. But there are some ways of preparing for that out there. And then, what just different things to think of: financial security. When this is that 2008 crash that happened, so this is an actual line of investing, and just be aware that like there's a point where once you retire and you need to live off your money, you can't afford like a drop like this if all your money's in the market. So the idea is like make sure like all your eggs aren't in one basket. Make sure you're diversified, protect yourself from that. It's more important once you retire, because a drop like this really ruined a lot of people in 2008. And then don't be fooled by confusing TV ads or mailers. Like a lot of the commercials are very confusing. Here's what they're trying to do. They're trying to get you on the phone to call them, and you're going to probably get a high pressure sales pitch to do some high pressure. Take your time. If you see something, call local agent, sit down with them so that you get to know your agent and they're in your area and they can find out what's best for you. Because you really, these high pressure sales over the phone. In my opinion, I probably shouldn't say this. I might get in trouble. I don't think it should be legal. I don't think you should be making medical decisions on high pressure sales over the phone. It takes us hours, sometimes 2.5 hours to sit with someone and really find out and delve in, like, what care do you need? What's your family history? What are we looking at? So to try to do that over the phone, and a lot of people will call up and be like, oh, I made a mistake, somebody called me, and sometimes they can be very confusing on there too. So my advice would be find a local agent, sit with them, have them come out, make sure they do both sides of Medicare, make sure they represent all the major companies, and I think you're in the best hands if you do that. With that, I'm here for any questions.
Well, Bill, I was just going to say I've been on Medicare for 2 years now. And to your point, number one most important thing is to get an agent. And a lot of people don't know that that's available to them at no cost. I've told a million people, you've got to go talk to somebody. And my husband and I are on different plans, and for the same thing. My husband had medical issues, I did not. And to Dan's point, I was shocked at how expensive it was going to be. But in the long run, it's awesome. It's a fixed amount, and we pay almost nothing out of pocket because we're on a supplement plan.
Yeah.
And then the supplement plan also has some benefits. I'm on United Healthcare, and it's got the Renew Active.
Right.
And that's great because I get free memberships to like Wise and health clubs and different things, which is an added benefit for me because I would be paying for those. And we travel a lot. So when we travel, it's been awesome. I needed care in Florida this year and everything was paid for.
Right.
So, but I highly recommend anybody go to Bill before you're ready to make any decisions.
Well, thank you.
I love that. Thank you, Sandy. Bill, I was going to ask, I know you work with veterans. How do you incorporate the same presentation for the veterans, or do you kind of change things up a little bit?
Well, so like some of the I don't do like just veteran, and maybe I should, presentations for them like specifically. We'll do open it up to everybody, but like obviously if we meet with them in their home and we talk to them individually, and that's really the best way to find out. You're like going to the seminars are great, but you're going to get like the average general knowledge, but to really delve into the specific needs that you have based on your specific health needs. And same thing with veterans. It just depends on their situation, how long they were in, if what kind of coverage they have. There's something called TRICARE for Life versus just some VA benefits on the side. So there's a whole spectrum of that too. So it just depends on where they fall in the spectrum on there. Good question though.
This was very very thorough. I can't imagine the 2-hour presentation.
Well, I can talk a little bit too. So sometimes if you're in a crowd and they're asking a lot of questions, that's usually when it's going to take 2 hours. and we try to tell people like to don't get into the individual questions that don't we call them 1% questions, like that pertain to 1% of the people. Like try to think in generalities, like questions that you have, like where I said something where you're confused.
Mm. Yeah.
So I think we need to have Bill's contact information for anybody watching or watches this later that would like to get personal with those questions.
Oh, yeah, I guess I should have. I didn't put that on there, but I can get. Let's see. I don't know if there's a way to.
Put it in the
And
chat.
Bill,
Okay, yeah, I'll put it in the chat. Let me quit sharing. Stop sharing here.
what we can do is we can put your do you prefer email or phone number? We can put that in our YouTube link and on Facebook as well.
Either way, and then and add Ashley, because Ashley's like really closer to you guys too. And she's here. And we do this together, like we're partners most of the time. We're together in the house together. We do the seminars together and all that. Me being the teacher, I'm just used to doing a lot of the speaking like this. So
Well, what I love about anytime I've gotten to coordinate with you guys, what I love is you guys have a way of breaking things down so it's in digestible chunks. And uh, because it is very, very involved. And so thank you for doing this today.
yeah, no problem. Thank you.
Yeah.
And let me. So would it be easier? Like, should I put that? Where's the chat at here? Okay.
Or I can just get your because I have your cell phone and your email. Do you prefer both?
Yeah, that's fine. Yeah.
Okay.
There's a chat box at the bottom, Bill.
Okay.
You're more than welcome to just articulate all that information here too.
Yeah. And yeah, you can call me at 937-361-0871. And then Ashley, what's yours?
My number is 513-498-0080.
Yeah, and that's probably the best way to like call us or text us. It's probably the best way to get a hold of us. We always have our phones on, so
This is awesome.
and if we don't answer right away, we will definitely, get back to you. Like, if I'm sitting with a client, obviously I don't answer my phone, but as soon as I get out, I call back.
Yeah.
In our hours, we work with when they need us to work.
Yeah. We work whenever
Okay.
and wherever. Like 90% of the time, we go to our clients' houses, but we will meet at libraries. Panera Breads, Starbuckses seem to be popular. Like we'll meet at those kind of locations too.
Nice.
Chamber conference rooms.
Yeah. Yes. Right. And one thing that's kind of cool is we're affiliated. We're like the preferred partners of the Elks, the AMVETS, the Eagles, and American Legion. So we'll meet clients at those locations too. We do that often because if they're in one of those groups, there's some discounts that they can get on certain things. So we'll meet at those locations as well.
Perfect. Well, Bill, thank you so much. This was amazing. I'm glad I got to sit for the whole thing because I'd caught a portion before at Basil. Well, I want to thank you guys for joining us this morning. We're going to be putting this on YouTube and also Facebook. If you guys have any questions, we encourage you to reach out to William, Jewell, Bill, and Ashley Watt as well. We have a few events coming up with the Chamber. We have a red carpet luncheon on May 14th. That is the graduation of Leadership Hamilton, an amazing initiative to get involved with Hamilton and make those deep-rooted relationships. We also have a ribbon cutting for Tide Pool Art Center that's coming up on May 15th. All of these you can find on our chamber calendar at hamilton-ohio.com. We also have a ribbon cutting for the newest coffee shop coming up in Hamilton, 7 Brew Coffee. That's May 18th. And then we have a networking leads lunch at Shooters Sports Grill in Hamilton. If you've not been, it is beautiful. The food is amazing. That's going to be on May 19th. Well, guys, I want to thank you so much for joining us today. Bill, thank you so much. We'll see everyone later, okay?
Thank you.
Thanks.
Have a good day.